see. Yep, it did. Thank you.
Okay, perfect. Yep. Okay, Dr. Jarvis, just grab my questions here. So I was talking with Karen over email earlier. With her, she was saying 9 swab to go test sites have opened, and 7 more are expected to open back up in the future. If I did my math correctly, I think that's 16. So why are all these testing sites opening back up again?
Yeah, so I want to be clear on that. I don't think we're intending to open up 7 additional ones. That would be all of ours together would be the 9. So, and that would be very similar to what we had done in the past when initially we were talking about a large number of individuals who needed to be tested, and we wanted to make sure that that was done in an efficient manner. And we are right back in that again right now. In fact, actually, we are seeing the number of tests that Northern Light Health Laboratories is running on a daily basis, setting a record each week to the total number of tests that we are currently running. And so it really is because of the demand and the need for us to be able to meet the demands of our community.
Thank you for that. And just to go back on what you first said, so are you only keeping 9 test sites open? Is that the plan?
Correct.
Okay. Thanks. I just wanted.
We'll obviously reevaluate what an individual community's needs are, and meet those needs as we have to. But right now, it is really just those original swab and go sites being opened.
All right. And with seeing this high demand for testing, what do you think about that? Are you happy all these people are being proactive and getting tested, or is it concerning that all these people need to get tested?
Yeah, it's actually a little bit of both. So it's good news that people are being tested if they feel that they've been exposed or something along those lines, and certainly if they have symptoms. The problem is that we have so many people who are symptomatic and needing to be tested that's where it's stretching the capacity not only at Northern Light Health, but across all of our testing sites across the entire state. And many individuals are finding it difficult to get tests done for things like travel, where there may be a particular requirement to be tested to enter or to leave the state. And with that said, because we are we are right now really needing to test people who, for clinical reasons, it's making it more difficult for people to find testing locations for other things.
So with all these 9 locations, how many people can they test, every day or every week? Do you know that number?
Yeah, so actually Northern Light Health has really been looking, I just looked at the numbers before I came on, been testing between 1,000 and 1,300 people every single day. So those are the number of tests that we're running. And of course, not all of those individuals are going through our swab and go sites. Many of them are visiting our hospitals or being seen in their primary care offices. And so we have other ways for those tests to be collected. And we do testing for other companies outside of the Northern Light Health umbrella. But yeah, we're testing more people than we ever had before.
Okay. And then, so these test sites are opening back up. And I think one in Waterville opened today. And then on Friday, the one across the street from the Bangor International Airport opened back up. How are those sites going? Is it smooth? Because we learned from the past when they were open, or has it been rough getting things started again?
Yeah, I heard about the site that's out on the Bangor Airport parking that they had no problems on Friday or over the weekend. Again, we've done this before. I hate to say that we're used to it, but unfortunately we are used to it. And have been able to manage that, and I expect that you'll see that at the rest of our locations as well. We were able to turn on for many people both an online scheduling process as well as by phone or by doctor's order, and so again, trying to make it as convenient as possible. And of course, we've continued to have testing done at many of our retail pharmacies as well.
Okay, and what kind of testing or tests are these sites doing? I spoke with Northern Light Inland Hospital, and they said they're just doing the personal swabs. So is it a mixture of that and the PCR testing?
Yeah, so actually that is a PCR test. So most individuals will wind up with a PCR test. We are doing some antigen testing as well. In most of our locations, the primary method for collecting the specimen will be that the individual actually inserts the swab themselves into their nose. So a little bit different if you had one of those original swabs that we did way back in the beginning of the pandemic. It is not the same kind of procedure anymore. A lot of that has to do with the technology has advanced, and we have learned learned a whole lot more. And so it's somewhat a kinder and gentler way of getting the swab done. You know, it's still not incredibly pleasant, but it isn't like the test that we had before that some people called the brain tickler. We don't do that anymore. The other nice thing about that is that it doesn't require the same level of personal protective equipment or PPE for our staff. So that makes it a little bit easier for us on a staffing model, and certainly easier on the staff to not have to be completely, you know, enclosed in a respirator and things like that. And so this makes it a little bit easier on everybody on both sides.
All right, thanks for clarifying that, Dr. Jarvis. And then this next one might be a little repetitive and obvious, but how is opening these test sites, opening them up again, how is that going to help you meet this high demand?
Yeah, well, one thing it does is it offloads a little bit of the amount of tests that we were doing at our primary care offices and our walk-in clinics. And so that allows them to continue to take care of the needs for other reasons, whether that be other acute illnesses besides COVID, chronic disease management, or preventative care. So it gives us a little bit more flexibility in that regard. Also, it makes it so that our labs themselves don't have to collect the specimens either. So it really frees that up to allow us to continue to do the things that we're supposed to be doing as a healthcare agency, that we continue to do even as we serve the communities during this pandemic.
And then my last question, Dr. Jarvis, are there any limits on who can get tested, or can anyone, you know, sign up for an appointment, go for a walk-in, anything like that?
Yeah, so I encourage anybody that's seeking testing to go onto our website and look at what resources are available in their local community to make sure that, one, they're getting the place that's closest to them, and to make sure, because there may be some slight differences between locations depending on either staffing or lab capabilities at that particular location. So please just, you know, make sure that you check out ahead before you show up and request a test.
Perfect. Thank you so much. That's all the questions I had. Chris, do you want to go ahead?
Yeah. Let's see if I can get my video on here. Come. Let's go. There we go. All right. Hey, sorry, we have clapping going on in the Zoom. Dr. Jarvis, I just wanted to ask.
That's what happens every time I get on air. Clapping everywhere.
Dr. Shaw had talked last week about supplies for testing being an issue. Is that something that hospitals in Maine, like Northern Light, are facing? Is the supply chain causing any problems for you guys?
So thankfully, right now, we seem to have an adequate supply to be able to do those PCR tests, or the tests that are we know are the most accurate for both symptomatic and asymptomatic individuals. We know that for individual brands, and again, we use about 5 different ways of doing testing for COVID-19. So sometimes there may be a little bit of a backlog in one area, but we'll be able to make that up in another one. But supply chain is always a concern for us. You know, we know that is difficult for manufacturers to keep up right now with the demand, and so it's something that we continue to check on a regular basis. Right now, we are not having any particular delays due to supply. Our delays really are on the demand side. As you know, we see that we're, you know, again, testing over 1,000 individuals every single day. You know, that becomes our backlog, and is really, again, the reason why many people are finding it difficult to find a test for travel or to start a college or something along those lines.
So just so I understand correctly, it's not so much the physical swabs, it's more the availability at a testing site, the staff you can put at a particular site that's causing the people to have to either go farther away or plan for a test at a later time. It's not a supply chain issue of an exact swab, is that right?
Correct. So I know that, you know, in the past we talked a lot about, you know, whether it was the swab, whether it was the test tube or the media that's in the test tube. Right now we are not seeing significant having significant concerns due to that. It is really just overall volume that may be the limitations of a particular site or a particular area. Again, one of the reasons why we opened up the Swab and Go locations was to be more convenient and to make it so that is not you know, the number of people, the volume of people wanting to get tested is not going to be a limit for us.
Got it. I had been talking with the state last week a little bit about over-the-counter at-home COVID-19 tests. Obviously, well, not obviously, but as you probably know, it's sort of a double-edged sword. It can be helpful in letting somebody know whether they are positive or negative for the virus. Unfortunately, what the state is telling me is that if you do one of those tests at home, since it's not done basically through their reporting mechanisms, the state doesn't get that info. So in a hypothetical situation, if somebody were to test positive using one of those over-the-counter or at-home tests, it's not necessarily reflected in the state's data. And I think it has to do with something about it. Actually, if somebody tests negative, it doesn't make it into the state's reporting the same way. Can you kind of explain for people who are out there who are doing exactly what we were talking about a second ago, trying to find a test close to them that's convenient, and they choose that over-the-counter option? Can you help explain for somebody what they should do as far as either letting the state know, or what would be your recommendation?
Yeah, so first and foremost, I think if you're symptomatic, you probably should get one of our tests done. So, not necessarily at Northern Light Health, but at any other location where the test is going to be run at a lab, because you really want to know an accurate result. And we know that there are limitations with those at-home tests, and we know that they unfortunately have a higher rate of both false positive and false negative. So it's hard to rely solely on those tests. Within healthcare, we tend to use that kind of test when we're doing serial testing, meaning that we're testing somebody, every 2 to 3 days or something along those lines, versus a one-time snapshot to say whether or not you have the infection or not. So we do offer some word of caution on that. And then, as you said, if those aren't getting reported out, then we really don't have a true sense of what the positivity rate is. But I will say, Northern Light Health is a pretty good bellwether of what's out in our community. And unfortunately, today, our 2-week positivity rate now is over 11%, which I believe is the highest it's ever been during this pandemic. I know the state's lab is a little bit different than that, but they also have are doing some testing for other organizations that we presume those tests should be negative before they're done. But out in our communities now, unfortunately, COVID is probably as high as it's ever been. And we're certainly seeing that in our hospitalizations, as well as, what we see around, schools and the like.
There was a lot of discussion early on in the pandemic about testing and testing numbers. And some people saying that, well, if you test more for the virus, if you are looking for it, yes, you will see more cases. But what we've seen, at least what we've heard from the state, I mean, back in February or so, we were seeing 600 tests per 100,000 people. Now we're down to around 330, 340, I think was the most recent number that he had put out. So we've almost cut that in half, but you're saying that our positivity rate is still going up. Can you help explain that for people who don't study it every day like we do?
Yeah, so I'm not actually sure what that particular number was that you were talking about. I can tell you that internally, Northern Light Health is testing more people than we ever have during this pandemic. Like I said, we're testing typically over 1,000 individuals a day, and the last 2 weeks were record-breaking weeks for the total amount that we've tested in a single week. And so we are testing more individuals than we have been. We do know that people were out. Initially we saw an increase in the number of people being tested simply because we had allergy season, we had some other cold viruses going around. But really, right now, it's all COVID. And so for us to be testing 1,000 people a day and 11% of those individuals are positive for COVID, that's a huge number and a huge jump in what we're talking about in overall cases per 100,000 than we had seen previously.
Can you just address then that point that people are making of, well, the numbers are going to be inflated if we are testing more people?
Yeah, that's not really how things work. In fact, it should be the opposite. If the more people we test, we actually see the numbers lower, because that means we're probably testing people who don't meet typical criteria for being positive, which is really what we're seeing now. And despite that, we are seeing many more positive cases. And so some of those people are asymptomatic. They may be being tested because of a work requirement, a school requirement, a travel requirement. And unfortunately, we're seeing those people positive as well. So it is not a factor of us, looking for people to be positive. It's because there are just so many positive people out there.
Thank you for taking the time to address that. I appreciate it. That's kind of it for me. Alex, is there anything else left on your end? I know that I asked a couple of questions there.
No, thank you so much. That's all that I had. So you're free, Dr. Jarvis.
Good.
Did we leave anything out?
Karen, did I miss anything?
No. Excellent job, everyone. So
All right.
you're good in the
All right.
Thank you, everyone.
Today?
Mine is yes.
And mine will be tomorrow morning.
Awesome. Thank you, guys. Appreciate it.
Thank you.
Thanks,
Bye.
guys.
Bye-bye.
Bye.